So good morning, good afternoon, and good evening to everyone joining us from the different parts of the world. Welcome to today's webinar on evidence-informed climate adaptation policies and strategies, focusing on cases within Sub-Saharan Africa. My name is Lisa Were. I'm a research scientist affiliated with the Kenya Medical Research Institute in Kenya, and I will be moderating this important discussion. So the session brings together experts from across Sub-Saharan Africa to explore how evidence is shaping climate and health adaptation policies within our region, as well as we'll also be looking at the progresses being made, the gaps, and we must also collectively address these gaps. Yes. So this session will run for about an hour and will include a brief panel discussion, a moderated question and answer session, and an open floor for the questions from the audience. So I would encourage everyone to stay engaged and active within the chat and the question and answer session. But kindly, just a bit of housekeeping. Let us please observe etiquette. Let us keep our microphones and videos off unless when we are speaking. And please also let us avoid interrupting each other. We can do this by utilizing the prompt on raising your hand to be able to be granted a chance to speak. So just a brief overview of our topic. We know that climate change has been identified as defining health issues in the 21st century, and its impacts, especially Sub-Saharan Africa, are greatly being felt in the areas of food security, access to water, disease outbreaks, and health system capacity. Despite being at least responsible for the global emissions as a continent, our countries remain most vulnerable to the effects of this climate change. Policies and strategies informed by evidence can really strengthen our resilience and response to these threats. And therefore, this is the focus of this discussion. The objective of our webinar, we have two main objectives. The first one is to look into evidence-informed policy aspects in climate and health area in the developing countries and how policies are formed and used. Our second objective would be to look at the impacts of these policies bringing in health and well-being. So we have an exciting set of panelists today. I think I shared the program with you. I hope you were able to see it. For those who are not able to see it, I had posted it on the WhatsApp group. So I will go ahead and introduce our esteemed panelists, who will later on have a brief presentation for us before we proceed to the panel discussions. So our panel includes Dr. Frederick Ouma, who's the Acting Director of Public Health Research and Informatics at the Kenya National Public Health Institute. We also expect to be having Dr. Adumna Woyesa, who's the Senior Expert on Climate and Health Adaptation Strategies in Ethiopia. We have Desele Ilak, who's the National Focal Point for Health Technology Assessment at Ethiopia's Ministry of Health. Last but not least, we have Dr. Fasil, who's a research associate at the Ethiopian Public Health Institute and is engaged in evidence synthesis and policy. We are greatly honored to have such a distinguished group of thoughtful leaders with us today. So we will go into the panel session, the panel session where each panelist will have a short presentation for us. To flag us off, I'll introduce Dr. Frederick Ouma. He's a registered pharmacist in the field of a field epidemiologist, and a public health researcher. He currently serves as the Acting Director of Public Health Research and Informatics at the Kenya National Public Health Institute. Previously, he has held roles as the Technical Advisor at the Ministry of Health, an epidemiologist at the National Malaria Control Program, and an Assistant Director of Pharmaceutical Services at the sub-national level. Dr. Uma has contributed to the development and validation of several national and continental strategic documents, including the African CDC's Continental Knowledge Management Framework and the Research Prioritization Strategy. His work focuses on climate resilience, equity in public health systems, and the use of advanced analytics and technology in infectious disease and control and prevention. So welcome, Dr. Uma. I'm just going to pull up your presentation.
All right, so thank you so much, and thank you for the opportunity to make this presentation. My name, as you've been told, is Frederick Ouma. I work for the Kenya National Public Health Institute. I'll make a presentation on evidence use in shaping climate and health adaptation policies, the Kenyan experience. So given the limited amount of time, this will just be an overview. I may not exhaustively discuss all the situations about evidences used to inform policy. But just for a quick overview, some of the areas where we have used evidence to inform policies would include in epidemiology and burden of disease. So we have been doing this to understand the climate-sensitive diseases. These would include the vector-borne diseases and like chikungunya, dengue, malaria, and the likes. Also things like cholera that frequently cause outbreaks in the country. As we speak, we have an active outbreak of cholera and chikungunya in the country. And of course, respiratory illnesses, which are also in season, given the current climatic conditions in the country. So for these kind of diseases, we largely rely on sources such as the Kenya Demographic and Health Survey, DHIS2, which we have renamed the Kenya Health Information System. DHIS is District Health Information System, so ours is a little customized to the country, but it's the same theme. Then we also rely on disease outbreak situational reports. Like I've mentioned, currently we are having a number of outbreaks, which includes other diseases like mpox that are found across the region. The other sources like Kenya Malaria Indicator Survey, for example, the current malaria burden in the country was determined by the last Kenya Malaria Indicator Survey, was used to conduct end-term review of the Kenya malaria strategy. And we have a new strategy in the country that was largely informed by the Kenya Malaria Indicator Survey. There are also other studies conducted by various institutions, universities, research institutions, including Cambridge, where Lisa works, and the MPHI where I work, and there are several other research institutions across the country, whether the government-owned or privately owned or non-governmental institutions. We also get them as sources for various policies. Then we also rely on climate data in projections. These are mostly used for modeling health impacts and guiding early warning systems and risk assessments. Currently, we are forming very strong, or rather we are strengthening our collaborations with the Kenya Meteorological Department. We have several areas in which we are really starting to work together to inform the understanding of some of these things are. For example, we started a project in which we are trying to work with the Kenya Meteorological Department to understand why cholera keeps recurring in the country. And it's a common problem almost every year during the rainy seasons. We have a cholera outbreak. So there's a project that has started on that note. Of course, there are many other areas in which we work with them, trying to get the rainfall temperature data from them. We also look at issues with the droughts and phenomena like El Nino, where we have excess rains, and La Nina, where there's extended droughts. And these have been happening in the country almost in alternate years. Then we also get data from sources such as the ICPAC, the IGAD Climate Prediction and Application Center, from which we get regional forecasts that also form part of the evidence for climate data. These reports have been combined with the local Kenya Meteorological Department data to predict how the climate is likely to be and help us prepare for things such as heavy rainfalls, flooding, and the likes, in which case we need to prepare for vector-borne diseases. The commonest ones are in the country of malaria, dengue, and even Rift Valley fever that also tends to occur every time we have a flooding situation in the country. There is also IPCC reports. IPCC is the Intergovernmental Panel on Climate Change that we look at the East African data, and I use that data to inform how we are going to project our action as far as climate and health is concerned. We also rely on other collaborations like the Weather and Climate Information Services for Africa and other sources of data that will give us climate and data projections. Now, another common source of data that the type of data that we use for policy are vulnerability and risk assessments, and these are conducted across the country by various actors, like the Ministry of Environment, the National Environment Management Authority, and partners like the USAID, and we have the Food and Agriculture Organization of the United Nations. We also get some data from the Kenya National Climate Change Action Plan, which works on several assessments. Then we have the Kenya Country Climate and Development Report that's usually produced by the World Bank, and that also forms part of the risk assessments, as well as reports from United Nations Environmental Program, the German, GIZ, which is the German Agency for International Cooperation, as well as Kenya Red Cross Climate Center. These we use to identify the populations and regions that are most at risk for various climate-related health risks. Another kind of data that we use to inform policy is One Health surveillance and research. So there are various organizations and institutions, state and non-state actors that come together from various sectors, including the animal environment and human health, that provide data that is useful for policy making on matters of climate and health. These include the Kenya Medical Research Institute, the Kenya Primate Research Institute, the NPHI, under which we have the Zoonotic Diseases Unit. All these work together and produce various forms of evidence that are useful in terms of One Health surveillance. We also work with the Food and Agriculture Organization of the United Nations, the International Livestock Research Institute, and various other institutions that produce various data on animal health, including those related to Rift Valley fever and other outbreak-prone diseases. We also have a One Health strategic evaluation that is conducted from the Kenya One Health strategic plan that helps us also get more data related to how all these sectors work together to inform public health. Then we also have implementation research and pilot programs. These give us operational insights from various interventions that are applied in across the 47 counties in the country. And there are various institutions that are conducting for various forms of research and piloting various projects across the country, including AMREF, LVCT Health, ICAP, and various other institutions across the country. We have various pilot projects that have been conducted on climate smart primary healthcare, like the use of solar power in various health facilities, to see how that then helps reduce reliance on fossil fuels, as well as the use of fossil fuels used in generators, as well as the use of the electricity, mainstream electricity, which is not always available across the country. And there are various forms of adaptation learning programs that are also conducted by Care Kenya across the country. So there are many forms of research that are conducted across the country that are useful for this one. And of course, there are all those publications that are published in various peer-reviewed journals that are also useful for informing policy. In summary, there are many other forms of evidence that are used to shape policy, including health systems and infrastructure assessments that are used to understand the capacity gaps in adapting to climate threats. We also use community-based participatory research, provide evidence that is more focused on the community, the local community, in form of getting things like indigenous knowledge, perceptions of various communities, the practices that would influence how they perceive climate and health. And we also have various forms of policy evaluation and economic modeling that are conducted by various institutions to assess cost effectiveness of various interventions and the impact of the adaptation interventions that are used across the country. So all these are applied by various organizations, including research institutions, non-governmental organizations, government institutions, among others across the country. So these are just a few examples of policy documents that have been formed by the evidence, various forms of evidence like the ones we've outlined. The National Climate Change Action Plan, currently running between 2023 and 2027. Even the previous one was informed by policy. We have the Kenya National Adaptation Plan, 2015 to 2030. We also have the Kenya National Climate Change Response Strategy. The Ministry of Health has a climate change and health strategy running from 2020 to 2025. It's currently being reviewed. And the Kenya One Health Strategic Plan, as well as the various counties, all the 47 counties in the country have county integrated development plans in which they have a climate and health component where they rely on various forms of evidence that are available across the country. So this is just a quick matrix to show the various plans and strategies and what kind of evidence was used to inform them. You'll find that by and large, we used all forms of evidence to inform these, as has been discussed earlier. So allow me to stop at that point in the interest of time. I believe we'll continue discussing more as we proceed. Thank you.
Thank you very much, Dr. Frederick. That was a really great presentation. You set a high pace for the rest of the presenters as well. Thank you. Maybe I could just call upon the next presenter. Desiree will be following Dr. Fred, that's Desiree Ilak. He is a health systems and policy expert with a focus on building resilient health infrastructure to address emerging challenges, including the impact of climate change. He currently serves as the National Focal Person for Health Technology Assessment at Ethiopia's Ministry of Health, where he guides evidence-based decisions. Desiree also serves as the International Consultant with the UNOPS, Horn of Africa Multi-Country Office, and is a member of the World Health Organization's Strategic and Technical Advisory Group for the medical devices. With over 9 years of experience, he has led the development of Ethiopia's HTA's roadmap and assessment guidelines. His practical experience includes serving as a former member of the Ethiopian Emergency Medical Team. In 2023, Desiree was awarded the prestigious Dr. Lee Jong-wook Fellowship. He holds a bachelor's degree in biomedical engineering from Jimma University and is currently a trainee in the Evidence to Policy program with ECAS. His background uniquely combines high-level policy implementation with hands-on technical experience. Welcome, Desiree.
Yeah, thank you very much. Good morning, all. I want to address how does climate adaptation policy and the strategies are implemented in my end. So in the outline indicates that there is several points what I want to address. The urgency of implementation in East African context and the framework of policy and strategies, how the policy implementations are implemented and how evidence is utilized, and how climate adaptation policy strategy implemented practice in Sub-Saharan African countries are adopted, and the stakeholders for the implementation and the challenges and the way forward will be included in my outlines. So why this matters to us now is one key question for all of us. So because of we are in high vulnerability because our economy, especially in Sub-Saharan African countries, our economy is heavily relying on rainfall, agriculture, pastoralism, and tourism. All those are climate sensitive areas. And also, we are experiencing on prolonged droughts and intensive floods and erratic rainfall patterns affected our fields. So the other thing is our livelihoods. For example, from poppy farmers in Uganda to pastoralists in Kenya and a freshman on Tanzania coast have currently a challenging area for climate change. So what is our goal? Our goal is to implement or plan effective on-ground actions to protect our communities regarding the climate impacts of our community. So let me, I want to address 2 points, policy and strategy. So as all we know that policy is architectural blueprint is a policy for a policymakers or the governments, a vision or a goal. When we come to strategy, the strategy is a step way to address the vision or the policy, what we need to do. So when we see the climate policy, when we differentiate or align the climate policy in adaptation strategy, when we say climate policy, what is that policy? Who will develop that policy? For example, currently in our country, in other sub-Saharan African countries, high-level governments develop policies depend on its commitment to the vision. So to adopt that or to implement that, we have a strategy. We are developing strategy that is action plans and specific interventions to achieve that policies. They should be sector specific and practical. For example, you can see the climate smart infrastructure programs integrated in water source management in coastal mangrove restoration projects. So this kind of projects have policy integrated with strategies. The other points what I want to address is that how it will be implemented. It is a continuous process. How it's supposed to be worked. First, what we do is that we have to assess the vulnerability assessment. Means that identifying who and what is the most risk area. But maybe the data will be asset from National Meteorology Agency and I think that. So from that assessment points, we have to plan, which is integrated with the national and the district development plans. So for that, if we have adopted and integrated within assessment points, we have to mobilize the resources. So the finance, the budget is a critical issue. So we have to mobilize the resources from the national state or international partners, the TFC, adaptation funds, and that officer. So after that, if we have a budget source or a funds, so we have to roll out the projects. After roll out the project, we have to track the progress. We have to learn. We have to put measures in what we learn. So these are the implementation cycles for policies, especially for climate policies. So how evidence is used in different ways. How was evidence being utilized in frame climate-related policy in Sub-Saharan African countries, especially? It is it depends on its type of events. I think will come later for the detail, and it depends on the mechanisms of influence. And also the other point is what the success stories. The success stories are the one for the evidence to be shared as the policies. The other thing is the major challenges, the gaps what we identified. For example, we can think that the policy issues, the political views, or some outbreaks will be the one for use for use as evidence. The other thing is how climate adaptation policy is strategy implemented in practice. So it is a multi-level approach to climate adaptation implementation. It's a chain way, so from national strategy to local actions. For example, when we see a national level, the national level will adopt policies and budgets, and also establish national climate funds. When we go to subnational level, the local and national plans in this policy will be integrated to the national, subnational level within the strategic plans. So we need to have train staffs and also disseminate climate info with by maybe we can use radios, SMSs, and meetings. So after that, the final point is what actions, what we did. The local community base, that is the farmers, maybe adopt a drought-resistant crops. Pastoralists will manage rangelands and water points. Communities plant mangroves and green seeds. So these are the multi-level approach to climate adaptation implementation. So for implementation of this, who are the stakeholders for the implementation? One is the national government. As I said earlier, sets a policies, secure international finances and coordinates. The other point is the decentralized or the district. It links with the domestic national policies and local level projects. So the other is NGOs and civil societies. They can help for mobilizing communities, building local capacity, and all governmental accountability. The other point is the private sectors. The private sector will do innovation that resists seed drought for technologies, solar irrigations, and finance. The other is the local communities and indigenous groups. They are the true experts for the environment. Their knowledge is vital for the success talk. The last point is researching academicians. They provide data, evidence, and monitoring for guiding the actions. So the other point is what are the gaps, the major challenges for the implementation of those policies? One is the financial gap, insufficient funding, and difficult access to international climate finance. The other is currently what challenging is the limited technical expertise for project design, especially at the eastern or local level. The other point is the red line is that policy action is connected. We have excellent paper-based policies, but we fail to translate into concrete action on the ground. The other point for the challenges areas are poor coordination with the government ministers and between national and local government. The last point is data for decisions. Lack of localized access climate data to inform effective planning. Those are the main challenges that we are facing in implementation policies. So what will be the way forward for this implementation? So starting from the gaps, what will be the way forward? Or what should be the reasoning for the implementation of this? The one is what empowering local actions and integrating or blending the scientific data within the local language. The third one is what unlocking private services. We have to engage the private sectors, and also we have to learn focus on the learning by doing. And also the last one was enhancing regional cooperations. It means that sharing lessons, practice, transboundary climate change. For example, water bathing is still controlled through platforms like in African countries in IGAD. So those are my presentation. I think I'll come back with the questions. Thank you very much.
Thank you. Thank you very much, Desiree, for this amazing presentation. I hope everyone has been able to absorb all the wisdom that has been channeled from the presentation. without further ado, I'll go ahead and introduce Dr. Fase Mengistu, who holds a bachelor's degree in veterinary medicine and a master's degree in veterinary public health, both from Addis Ababa University. He has over 10 years of research experience and is currently working as a research associate at the Ethiopian Public Health Institute, where he is fully engaged in evidence synthesis to support policy decisions. He has authored 3 policy briefs, 1 systematic review protocol, and 3 rapid reviews. He is a trainee at the Mid-Level Evidence to Policy program organized by ACAS Uganda, and his work focuses on strengthening the use of evidence in public health policy. Welcome, Fasil.
So, good morning, everyone. Thank you, Lisa, for the introduction. So, it's a great pleasure for me to have you all today for this webinar. So, I'll be speaking on the key challenges and gaps with climate adaptation policies and strategies we have in Africa. So, I will give a very brief introduction on the climate adaptation strategies and policies we have, and then I will be focusing on at least 4 major challenges we have related to the policy. So as an introduction, Africa is a continent which is most vulnerable to climate change. And this climate change is expected to severely disrupt water and food system, the public health, and the agricultural livelihoods. So these impacts include increase in drought, rising in sea levels, and changing vector-borne diseases, as Dr. Frederick was previously speaking, because many vector-borne diseases are transmitted through vectors like Aedes and Culex mosquitoes, which are take a chance in to proliferate in large number in relation with climate change. So climate adaptation is very important for Africa's climate policy, which should emphasize on resilience and reducing vulnerability. So the adaptation challenges can include, it has a wide perspective. It has a technical, political, institutional, economic, and social, and the biophysical factors are highly challenging the adaptation policies and strategies we have in Africa. So very accurate climate impact projections are very important, yet many African nations are really lacking data in relation with weather and climate. So the other important point is institutional leadership is very essential for adapting the future risks while developing policies and programs. And we should able to engage various stakeholders and also inject resources while implementing the policies we have. However, there are penalties in rural extension services and neglecting emerging climate risk, which posing significant barriers region-wide. So NAPA, the National Adaptation policies for action is very important in managing climate change risks in Africa. But as I earlier stated, it lacks connection with key sectors like the agriculture and the water resource sector. So mainstreaming the NAPA's National Adaptation Plan for Action is very important with various sectors. Again, the challenge is the climate and weather data gaps we have and the limited technical capacity, which really hinder the adaptation efforts that Africa is trying to put in place. So despite many African countries producing their own national adaptation policies for action, defining its priority is still a significant issue. So integrating the agricultural innovation into the NAPA is very important again in terms of improving climate resilience in Africa. And the challenge still were lacking access to climate information, weak institutional support, insufficient funding, and poor infrastructures are really hindering sustainable agricultural practice in Africa. So, as a collaborative effort involving government, international organizations, local communities is very essential to develop strategies that prioritize agricultural innovation and enhance the climate resilience. So, the first and most challenge related to climate adaptation is the climate data scenarios and impact models are inadequately found to support a climate adaptation plan we have in Africa. So this means many nations in Africa are lacking a reliable long-term climate data sets for regional analysis. Africa is struggling with insufficient climate change data over the past centuries, which is highlighted by the need for better monitoring system. So the key challenge in addressing future climate impact is the limited understanding how this affects us and the precipitation occurring after. The adaptation response so far has been limited. It's not adequately respond to the climate change, and it is fragmented. It's not comprehensive, and it lacks local engagement. So this means many African governments, they are neglecting adaptation strategies and related to the agriculture and farmers' preparedness for climate change. So lack of prioritization for developing measures to inform farmers about temperature and rainfall change is really affecting the crop production. So farming water management practices are poorly integrated into the proposed adaptation strategies across the continent. So the third point is adaptation policies and programs we have is lacking broad focus. It is very narrow. It's not very comprehensive. It means the adaptation projects are often ignore key development issues like food insecurity, poverty, health, and population distribution, focusing mainly on climate change related risks. And the last important point is the adaptation finance is lacking. Next slide, please. So this is the last point, which is the adaptation finance is lacking because as I earlier stated, many African countries are to have their own NAPAs, National Adaptation Policies and for Action, but it's not supported by adequate finance. And the capacity to develop and implement adaptation measures is also a limiting factor. So many African nations, they are really face resource shortage, making financial support crucial for effective adaptation practices. So the development of national adaptation programs for action is essential for accessing funds to manage the adaptation projects that the countries do have. So these are major or important challenges and gaps related with climate adaptation policies and strategies that many African countries do have. Thank you so much.
Thank you to all our panelists. Thank you to for all your insightful remarks. In the interest of time, I will now guide us through a short discussion, picking a few targeted questions for each of you. Focusing on the key themes that you had highlighted, we could start with Dr. Frederick. What types of research evidence have proven to be most influential in shaping climate and health adaptation policies in your country? I'll just come again. What types of research evidence have proven most influential in shaping climate and health adaptation policies in your country?
Thank you, Lisa. In terms of influence of the various types of evidence that I mentioned earlier, it appears that the forms of evidence that seem to illustrate some sort of cause and effect relationship between climate and health seem to be among the most influential. If particular type of evidence seems to directly link the impact of climate change and health, for example, things like epidemiological data and burden of disease. If it's seen clearly that there is, for example, a disease outbreak during a heavy rain season, then that evidence of the disease outbreak, together with the evidence from the climate side, then seems to be most influential in determining its use for informing policies. And this is seen mostly when it comes to things like malaria, where we use malaria incidence maps during flooding periods to easily influence decision making because of that almost direct link. Same to cholera as well. When you look at WASH data and during rainfall, then you are able to quickly determine what should be done. So that would include things like climate data and projections, as well as the epidemiological data that is available in the country. Also, vulnerability and risk assessments that are conducted sometimes tend to identify hotspots, and that also tends to be prioritized because of the way in which you can quickly do these assessments and inform some action. So that makes it also quite useful. In addition, the ones that seem to also be given priority are more of the quantitative kind of evidence. Any evidence that produces quantitative data generally seems to get more attention, and therefore seems to influence policy more directly as compared to qualitative form of data. And finally, I would say that the data that seems to come from government sources, the ones that seem to come from government systems, like the routine surveillance data from the DHIS2, also seems to be given priority. And also institutions within the government, like the Ministry of Health, the Kenya Meteorological Department, the Zoonotic Diseases Unit, whatever kind of data they produce seems to be more influential as compared to other institutions. Well, institutions like WHO also are ranked very highly, so they also tend to be more influential. I hope that responds to the question, Lisa.
Yes, very accurately. Thank you very much. Quickly, I'll move to Desiree. In your capacity, can you share how evidence has been applied in designing or revising climate adaptation strategies? I'll come again. In your capacity, are you in a position to share how evidence has been practically used in designing or revising climate adaptation strategies? Welcome, Desiree.
Okay, thank you. Yes, I was highlighted on my presentation actually these crucial questions. So the climate adaptation policies and strategies are implemented in practice in chain way. That is from national level to local communities. So the national level will address the policy development and budgeting issues, and the subnational level will have localizing national plans with district strategies, and the local community will adopt and work practical activities. Saying that actually Ethiopia have a national level strategies for climate change. That is climate resilience green economy. It is launched in 2011. This strategy integrated with scientific modeling, climate risk assessments, and sectoral data to guide low carbon development in resilience buildings. It uses 4 pillars for that strategy, which is sustainable agriculture, and fostering and renewable energy and transport. So to localizing this evidences into agricultural adaptation, there is a micro level studies like benchmark zones. So combining multi-adaptation practices such as crop diversification and soil conservation and livelihood diversifications. So I have, I think I address your questions, Lisa. Thank you.
Yes, you have. Thank you, Desale. Dr. Fasil, from your experience, your work experience, through the presentation you've made, what do you think are now the most significant challenges you have personally encountered while you are trying to integrate the evidence into climate policy? In your capacity, what are the main challenges you have personally encountered based on now lifting from your presentation, just the main ones that you have personally encountered?
Okay, thank you, Lisa. Actually, I have tried to look into several indicators related with climate change. I made Google Scholar and other relevant databases, and actually there are several systematic reviews and literature reviews have been adequately written on climate change. So I think there is ample amount of information is available in climate adaptation policies and strategies. But in relation to with the context of Ethiopia, I have tried to communicate with my personal capacity. There is no problem in accessing information on climate change, but I try to communicate. Dr. Adunya, I deliberately tried to join him to the team, but actually he cannot able to join us because he's technically advising the Minister of Health on climate adaptation strategies and policies. But he shared with me already the plan they do have on the Minister of Health, which is the Health National Adaptation Plan for 2024 to 2028, and it is exhaustively addressing many issues on climate change, and they are trying to look into some of the evidences to put in place their policy and strategies, and they are focusing on 5 major issues, and they also try to address around 12 national strategies in climate adaptation in Ethiopia. So I think there is no such difficulties in accessing evidences regarding to climate adaptation in Africa. Thank you, sir.
Thank you very much, Fasil, for that. Now I'd like to say also thank you for all the facilitators, the panelists who have been able to come through. Now I'd like to open the floor for a question and answer session. I'll be brief as I see our time has run out. Maybe we could just allocate 3 additional minutes for that. Feel free to raise your hand or drop a question in the chat box for our panelists. We'll be able to address them. You could also just raise your hand and I'll be able to pick you and have your question aired. Welcome, those in attendance. Florence is asking if the screen is going to be shared. I believe you're asking if the recording is going to be shared. Yes, we will make it available. Oh, there's a hand raised? Okay, Caroline. Welcome. Take the stage. You can ask a question. You can ask to the whole group or directly to one of the panelists. Please feel free. Welcome, Caroline.
Okay, my question was about what are some of the opportunities that maybe the presenters or anyone on the webinar can try to share with us on how we can engage the private sector in particular, given that sometimes the private sector, especially the big companies, have some sort of power and influence, especially in regards to dedicating resources to this climate and health or climate responses. So how do we engage them more so that we can work together and reduce the fragmented efforts that some of the colleagues were talking about? But I'm more interested in the private sector. I know we may not be familiar with it, but I don't know if there are any opportunities that we see in our countries where we can increase the engagement of the private sector to support climate and health responses.
Can I react to that?
Yes, Fasil, you can respond.
Thank you, Caroline. I think you raised a very important issue, but as long as I know, with the Ethiopian context, I tried to look into the climate adaptation plan they produced from the Ministry of Health, but it doesn't engage the private sectors. But I think it's very important, to engage different stakeholders, even NGOs and the private sectors. I think the problem is that the private sectors, unless they benefited from these policies and strategies, they may be retrained to join the effect of the climate adaptation, because most private sectors are really interested on their own benefit. But it is very important. If the interests are there, it would be nice that the government would not be working alone with the adaptation plan, but the private sectors may contribute much on supporting the government effort on the climate adaptation. Thank you.
Thank you, Fasil. Does anyone from the group have anything to add on Fasil's strong base? On the opportunities and ways in engaging the private sector that is involved in climate health to be able to join forces towards this, especially due to their resource backing, etc. Caroline, does Fasil respond to your question? Has that answered your question adequately?
Yes.
Thank you. Peter, welcome. You had a question as well.
Yeah, yes, please. I had actually put it in the Q&A, but I think it was not being seen. I just wanted to ask Frederick about Kenya's evidence space with climate change, and I wanted to understand better some of the challenges in Kenya, and also whether some key challenges, maybe like 3. What are some of the things that have been done to those issues? Because we have had quite a very good discussion from the broader aspect of the Sub-Saharan region, including issues like funds, including issues like limited data, including issues like like a poor infrastructure. So I just wanted to understand from the Kenyan perspective. Thank you.
Yeah, Lisa, if I may respond to that.
Yes, please go ahead.
Yeah, thank you, Peter, for that great question. And indeed, I think most sub-Saharan African countries are likely to be experiencing more or less similar challenges when it comes to the use of evidence to inform policy. I would say that some of the constraints would include financial constraints, of course, that comes to mind first, because of the issue of funding. Generally, we rely so much on donor funding. Most of our activities that generate evidence tend to be donor funded to a great extent, yeah. And therefore, financial constraint then becomes a big challenge in terms of evidence generation and use. Another one would be, let me say, technical constraints. You find that in our country, though this is being worked on, but there's still limited capacity for the complex data analytics, and to some extent also lack of some tools that would be useful for generating this kind of evidence that would be required. So generally, lack of capacity in various institutions, particularly government institutions that are responsible for generating policies, then would create a challenge. To some extent, you find there are relatively few health data analysts, climate and health data analysts, people who are specialized in correlating climate and health data. Modeling, it's picking up, but still limited in use across the country. And quite a number of counties that in Kenya tend to have few epidemiologists. So even using that epidemiological data might become a challenge, because whenever they have the epidemiologists, then they are focused on responding to diseases rather than really working on the evidence and translating into policy. And there are also a bit of challenges with the translation of evidence into policy. There could be other challenges, like legal challenges. Kenya recently enacted a Digital Health Act, which brings in certain, I would say, restrictions, although they are generally good guidance, but people are yet to fully comprehend what then would constitute a breach of the digital health regulations. So there are several regulations there. There are certain requirements that are required in various systems that are being used in health data. There's also a Data Privacy Act that also imposes certain limitations, and therefore there's a bit of fear when it comes to data sharing, some barriers there. There's some unclear mandates when it comes to data sharing and use of evidence. And yeah, that I would say also hinders quite a bit of that. There are also a few constraints that I would say are more of operational, like the DHIS2 data. We know to some extent some of the data really is delayed. There's an issue with timeliness, not just timeliness in reporting, but naturally, like the weekly surveillance data is reported weekly. That means there's at least a 7-day delay in that data. By the time it's being obtained, it means something could have progressed for a couple of days. So that delay by some days then causes a bit of an issue. The Kenya National Public Health Institute is trying to work on building a case-based surveillance system that would be more responsive and giving more timely data. But currently we have that as a challenge. We also have a few social challenges when it comes to understanding and use of community knowledge data. They're issued with inclusivity. We are currently just trying to roll out a project that would make sure that we can include persons with disabilities in emergency preparedness and response, but that has been really lacking. Yeah, there are few institutional challenges, like sometimes it's not clear who's really responsible for certain forms of evidence, or there are many people generating evidence from where, but there's poor coordination. There could be evidence from universities, from institutions that are known like Cambridge, but really there's no clear platform for bringing this together to form concrete evidence that can move people forward in a collaborative manner. So yeah, I would say those are some of the challenges, constraints that we're experiencing. Thank you.
Thank you very much. I hope, Peter, your question has been adequately responded to.
Yes, please. Thank you.
Thank you. I think that's about it. I'm not seeing any additional comments and questions. So just to come to a close today's session, I'd like to thank all our brilliant panelists for sharing their experiences and from their countries, and to all of you who were able to participate by asking questions, and those who are silently listening, we also thank you very much. I hope we've all been able to carry home a few takeaways on the role of evidence in shaping climate adaptation strategies, as well as their challenges, especially in the low resource settings. We hope this webinar sparks ideas to your own work, and we encourage you to continue this conversation within your institutions and your networks. I think our recording will be available, and any follow-up questions and materials will be shared to you via email. With that, I thank you once again, and I wish you a productive day ahead and end of the month. Yes. Goodbye to everyone, and take care.
Thank you all. Goodbye.
Thank you. Goodbye.